who is going to give us a brief overview of some important information that was covered in webinar 1. So Emily, you can take it away.
Great, and thanks, Julia. Hi, everybody. My name is Emily Cooper, and I work at MassHealth and Elder Affairs on issues related to homelessness and housing. This webinar series came about because we have heard a fair amount from providers who are working with people experiencing homelessness that, not surprisingly, MassHealth is complicated and hard to navigate and hard to understand. And so we want to make the information as easy to access as possible. So as Julia mentioned, this is the second in a series. The first webinar covered things related to applying for MassHealth. One of the things we talked about was when you apply, depending on your circumstances, you might be assigned a different types of coverage, MassHealth coverage, from a very sort of limited coverage to more comprehensive coverage, and the more comprehensive coverage, the more services you have access to. We also talked about how some people are, everybody is given the choice, or some people are given the choice to enroll in what's called a managed care health plan. That's an insurance plan. And we have multiple different kinds and multiple different names. And depending on whether you are enrolled in one of those health plans also dictates whether or not you can get access to some services. So I'm going to start with some background, just because to cue up what Susan and Jess are going to share with us when they talk about coverage and plans and things like that. I also want to just say that this webinar came about because we've been hearing a lot from people about people who are experiencing homelessness or who were previously homeless, and that they have needs for services, that what we call long-term services and support. So needs for help going to the bathroom or showering or getting around, or needing grab bars, or needing to go to a day program, or things that often are associated with people with disabilities or older adults. And sometimes people experiencing homelessness may be chronologically young, but their body from living on the streets is clinically older and their health is clinically older. So they often need access to these services maybe earlier than some other folks. So we want to make sure you know how to help somebody access these services and know how to navigate them. They're not things that are really that often homeless providers are well versed in. It's like you're not really familiar with personal care attendants and durable medical equipment and activities of daily living. So we wanted to make sure that information was available to you. So I'm just going to share my screen for a second here and get us started. This is the webinar on long-term services and supports. And as I mentioned, you're going to hear from Susan about different LTSS, long-term services and supports, services that are available through MassHealth. But whether or not someone can get those services is going to vary based on a couple of things. And one is their MassHealth coverage. So MassHealth has a variety of different coverage types, with the top being standard. I think gold standard, like that is the most comprehensive MassHealth coverage type you can have, down to, and you'll see either the health safety net, or if you're an older adult, which says SACA, that means older adult, you would have access to the Medicare Saving Program. So the people on the bottom of these tiers, if you have that coverage, it entitles you to the least services. And at the top, the standard entitles you to the most. So you're going to hear from Susan that some things are available to people on MassHealth Standard or Common Health, but they might not be for MassHealth Care Plus, for example. I just want to say that these coverage types aren't always static. They are dictated by the person's income and characteristics. So if you're pregnant, or you're a person with a disability, or you need help with activities of daily living or something like that, if you let MassHealth know those things, your coverage type would change. So for example, if you are on Care Plus, and that's because when you applied, you told us certain things and we said, oh, you're eligible for Care Plus. If you told us other things like, I'm medically frail, I need help, I need these LTSS supports, these long-term services and supports, and you told us that, then we would be able to say, oh, well, really, you should be on MassHealth Standard or Common Health. So these are not static coverage types in that you can have a conversation with MassHealth if something in your life has changed or something in your ability to navigate the world and see if that changes your coverage type. But it's important when you're working with people to know, are they on MassHealth? And what kind of coverage type do they have? If you don't know, we can put in the chat or at the end of this the MassHealth customer service line, and you can call the person, we call them members, can call anytime that the MassHealth service customer service line is open and say, hey, this is Emily Cooper. I don't understand. I went to this webinar. Can you tell me what coverage type I have? And they will let you know. And then you can also have that discussion saying, they said that, I should let you know that I'm experiencing homelessness, that I need help with LTSS, and you can see if that coverage type would change. The other thing that plays a role into whether or not you have access to LTSS, as Susan's going to talk about, and Jess is going to talk about things that are for people who are in managed care. So we have lots of managed care plans, and there are different types. You see them on the screen there. The Accountable Care Partnership Plan, the Primary Care ACO, the Managed Care, the PCC plan, a whole bunch of acronyms that you're not that familiar with. Most people under 65 are automatically assigned to one of these plans, or if you haven't chosen one yourself. So most people under 65 on MassHealth are in one of these plans. And if you're in one of these plans, you may have access to some of the things that Jess and Susan are going to talk about. So again, when you are working with a MassHealth member, you're going to want to know, are they on MassHealth? What type of coverage do they have? And are they enrolled in a plan? What type or name is the plan? This may all be on their card. They might have a MassHealth card or a plan card. But again, if you don't know, this is easily something that MassHealth customer service can help with. So we have these type of plans here. We also have something called One Care. That's another type of plan. This is for people who are under 65 as well, but they're on Medicare and MassHealth. So you're going to hear a little bit about One Care from Susan. We also have something that's called Senior Care Options, or SCO. It's for people 65 and older. Note, for One Care or SCO, we don't automatically put you in those plans. So if you're not in a plan, because we don't put you in one or you haven't chosen to be in one, you're in what's called fee-for-service MassHealth, which means, let's say approximately, I don't know, 80, 90% of people on MassHealth are in a plan. We have like 10 or 20% that are in, and I'm making up those numbers, by the way, are in fee-for-service, which means they go to their doctor and we pay their doctor. There's no plan in the middle that gives them access to care coordination or gym memberships or transportation or all those different things. It's something to be aware of when you are listening. And again, when you're working with folks, are they in a plan? What's the plan's name? What type of coverage do they have? And PACE being another one of the plans. These are ways here. We're going to give these PowerPoints out at the end. But if what I said to you sounded like, Charlie Brown's parents, they used to say wah 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 wah. Sorry, I may be dating myself there, but what I said sounded really confusing. You can go to my ombudsman and say, I have somebody here who needs, some of these long-term services and supports. Can you help us navigate how to get that? You can also, with the member, can set up a My Services portal where they can put their information and they can get information back about their MassHealth coverage. And we have a self-service system where you can go in as a member and just put in your information or call the phone number and we will get you all the information that you have. This is also where you would let them know if anything has changed, like I now need help with LTSS or I'm experiencing homelessness, which might change one of those coverage types. So I'm going to stop sharing and I'm going to send this over to Susan Ciccarello. And Susan, can you introduce yourself for the crowd too before you get started?
I sure can. Hi, everyone. I'm Susan Ciccarello. I work at the Office of Long-Term Services and Supports at MassHealth. I'm really excited to be here and present to you all about a little bit of our offerings at the Office of Long-Term Services and Supports. So one sec. I am also going to share my screen. Before I start, can folks see my screen?
Yes, we can see it.
Cool.
Yeah.
Awesome. Thank you. Um, okay. So I'm going to be touching on a lot of what Emily just walked us through. Thank you, Emily. That was super, super helpful. Super um, perfect stage setting. So here at the Office of Long-Term Services and Supports, our goal is to serve individuals who require support to stay either in the community or in the setting of their choice. Um, and many of the folks who are served with us at LTSS have disabilities or chronic medical conditions. Many require assistance with activities of daily living. We use this term a lot, ADLs. Those are things like dressing, bathing, grooming, mobility, or IADLs, which are the instrumental activities of daily living, like laundry, shopping, housekeeping, to meet their daily needs, promote independence, and improve the quality of our members' lives. At LTSS, we serve approximately 300,000 individuals. Um, and again, in the scheme of MassHealth, that's pretty tiny. There's 2 million members on MassHealth, but these are very, very important subset of our members. At MassHealth, we offer a giant array of LTSS services, um, the broadest array of any state in the country. Those include community-based services. Like, as Emily said, we have some day programs, adult day health and day habilitation. Also, some programs that come to a member's home, like group adult foster care, personal care attendant, home health, um, continuous skilled nursing. We also have facility-based programs at MassHealth, including our chronic disease and rehab hospitals and nursing facilities. In addition to all of these programs, we have 10 waivers offered through the Office of Long-Term Services and Supports. These are referred to our home and community-based waivers. I am not going to speak to the waivers today, and I'm not going to speak to every single program we offer at LTSS. I'm going to speak to the ones that I think are important to this group, but happy to share information about any of the other programs if folks have questions or would like more information. Um, so who qualifies for MassHealth? For gosh, I'm not going into that because I can't speak to who qualifies for MassHealth as well as others can, but who qualifies for LTSS? It would depend upon a member's MassHealth coverage type, as Emily just spoke to, and also whether the individual would meet clinical eligibility for those services. So for each service that we walk through, I'm going to highlight the MassHealth coverage types that a person would be able to receive these services for. And I'm going to point you guys to where the clinical eligibility is. Uh, and the other question that I feel like is going to be really helpful for you all is understanding how a member starts the process of, of getting long-term services and supports. Oftentimes, the process will start with a primary care physician referral. Um, Certainly for home health, that is typically the way the process will start. Um, Oftentimes a member will call the MassHealth Customer Service Center, and the number is here. That's the 800-849-2900, to not only confirm their MassHealth coverage type, but also to find out what LTSS providers are in their area. We additionally have um, another call center that can help members navigate through the long-term services and support system, which is Mass Options. They are able to speak to not only the MassHealth covered LTSS services, but also other state agency services that a person may be eligible for. And that number is here also, 800-243-4636. And for members who are enrolled in a health plan, as Emily just spoke to, this includes ACO, MCO, OneCare, SCO, and PACE. The health plan should help the member with accessing LTSS services. And this is just broadly what are some of the things that long-term services and supports can help an eligible member with, again, assistance with the activities of daily living, assistance with instrumental activities of daily living. But there's also skilled care that can be provided um, through LTSS services, such as wound care and therapies. This could be like post-hospital skilled care, or also we have continuous skilled care that could be offered to folks if they meet eligibility requirements. Additionally, medical equipment and supplies are offered through long-term services and supports. And this could range from a wheelchair to um, to very simple medical supplies, including like absorbent products or a personal emergency response system for members. I'll give you more information on that. Um, so the first service I wanted to talk through that I think is going to be of interest to this group is the Group Adult Foster Care Program. This program provides daily assistance with activities of daily living, instrumental activities of daily living, to members who are enrolled in MassHealth Standard or MassHealth Common Health, where a nurse will come out, provide case management, meet with a member, determine the member's care needs, and direct care workers will come to a member's place of residence, so generally to their home, to provide care to the member, and nurses and case managers monitor the member's care. This is our like lowest threshold LTSS services. So the clinical eligibility requirements can be found at this regulatory link here, 130 CMR 408-506. I didn't actually put the live link there just in case sometimes those links break, but you can just drop that into the into any browser and it will bring up the Group Adult Foster Care clinical eligibility requirements. This program serves individuals who are 22 or older. And again, it has lower care needs than most of our other LTSS services. The service does require a clinical eligibility assessment be conducted. And one like interesting, unique thing about the Group Adult Foster Care Program is we do have assisted living residences that are group adult foster care providers. And members are able to access group adult foster care at an assisted living who is providing group adult foster care services. And there also is a subsidy, a rental subsidy that's provided to those members through the Social Security Administration. For someone who is interested in group adult foster care, this probably won't be a service a primary care physician would say, oh, this is a great one, just because they wouldn't know about it. I would recommend first figuring out if a person is on Common Health or Standard, and then reaching out to Mass Options for a list of group adult foster care providers in the members area. And again, this is a community-based program where the direct care planning is provided in a member's residence. The next program I'm going to talk about is the personal care attendant program. This is definitely our most widely used program at the Office of Long-Term Services and Supports. And this program is for our MassHealth members with permanent or chronic disabilities who require hands-on care with activities of daily living and instrumental activities of daily living. What's super unique about this program, it is a consumer-directed program, meaning our MassHealth members act as the employers of their own personal care attendants. So our members have the responsibility for recruiting, hiring, training, and supervising their own PCAs. And just as an aside, no other insurance covers PCA, and there's no other insurance that covers group adult foster care services either in the same ways. For PCA, a member must have either MassHealth Standard or MassHealth Common Health, and the clinical eligibility regulations are just here at the bottom here. So the personal care attendant program, as I described, a member is recruiting, hiring, and training their own PCA. We do have a network of personal care management agencies who will go out to a member's place of residence, evaluate a member to determine how much personal care attendant time they need. And they also train a member on how to be an employer of PCAs. There's 17 of those personal care management agencies, and we do also, this program is a little complicated, have a fiscal intermediary, a single fiscal intermediary who is Tempus, who acts as the employer agent for our members. So they are the ones who actually process payroll and timesheets and cut the checks. I don't think there's actual physical checks anymore. They deposit into the PCA's accounts. So although our members are employers, they don't have to deal with all of the taxes and the payroll that goes along with being the employer. PCA is available to eligible members of all ages and all disability types. For the program, it is not a super quick turnaround to get on. It takes a bit between an eligibility assessment and training folks on how to be an employer. It takes at least 45 days for a person to start PCA services. And to get started with this program, you might hear from a physician that this would be a good program for a member, but generally starting the outreach with a PCM in the members area is probably the best way to go. And of course, confirming that a person is eligible for standard or common health. Okay. The next service I'm going to talk about is home health services. This is probably a service that most folks have heard about. It is covered by other insurance. It's covered by Medicare. And we do have a big network of home health agencies in Massachusetts, and they provide nursing visits, home health aid services, physical therapy, speech therapy, and occupational therapy to MassHealth members in their homes and community. To receive home health services and have MassHealth pay for them, a member would have to be on standard, common health, family assistance, Care Plus, and I put family assistance there twice, just once. You only need to be on family assistance once. And the member clinical eligibility regulation is listed here also. And there is also member medical necessity criteria that's listed on our mass.gov webpage. Generally, for home health services, a primary care physician would make a referral for home health services. And again, home health is provided to members of all ages, as long as the member has a skilled need or a need for therapy services. Okay, our next service, durable medical equipment. This again is a really broad service covering lots of different kind of equipment and supplies. And we do have, again, a really broad network of durable medical equipment providers. One other just highlight is quite a bit of durable medical equipment and supplies are supplied through pharmacies. And again, the services include sometimes purchase. Generally, it is purchase for some of the smaller dollar items, but also rental, repair of customized equipment and mobility equipment. And also MassHealth does cover absorbent products. And let me see, to be eligible to receive durable medical equipment through MassHealth, member must have standard, common health, family assistance, or Care Plus, and the member must meet the eligibility requirements described here at these regs. I do want to point you guys to something here on this next slide. Again, DME is supplied to folks of all ages and disabilities. But one thing that is a really neat tool that we have on our mass.gov website is we have a DME and oxygen payment and coverage guideline tool. So you can look up and see what kind of DME is covered. If a person needs like a bed rail or a grab bar, you can look and see exactly what is covered. And generally, your primary care physician would make the referral or write a prescription for durable medical equipment. Okay. And the last service I'm going to talk to you guys a little bit more in depth about is hospice. Our hospice service is covered by other insurances. I'm sure folks have heard of this service before. It's an all-inclusive benefit offered to members at end of life. And it meets all the needs of a member related to their terminal illness and also provides services to a family who's taking care of the member's psychosocial, spiritual, and emotional needs. A person must voluntarily elect hospice, and during that election time, a physician must certify the member as being terminally ill with a life expectancy of 6 months or less. Hospice is covered under MassHealth Standard, Common Health, Family Assistance, and Care Plus. And again, clinical eligibility requirements, there needs to be the certification of terminal illness, and the regs are here that point to that. And the hospice program serves folks of all ages who are certified by a physician as having a terminal illness. And one other just highlight, when a member does elect to receive hospice benefits, they waive the right to receive some other benefits. However, if a person is receiving PCA benefits prior to selecting hospice, they would be able to continue to receive those benefits. And to access hospice services, you should definitely start with a discussion with your primary care physician. Okay, and those are my slides for MassHealth LTSS. I'm going to stop sharing and hand over to Jessica.
Thanks, Susan. Let me share my screen. Hi, everyone. Can you guys see my screen? Just want to make sure. Great, thank you. My name is Jess Plant. I am the Policy Program Manager for the Community Partners Program here at MassHealth. A lot of what has been touched on already is lumped into the Community Partners Program, so I'm just going to dive right into it. The Community Partners Program is a program where community-based organizations are contracted by MassHealth to provide enhanced care coordination for MassHealth members with really complex needs. This program is available to members who are enrolled in those managed care organizations and accountable care organizations that Emily mentioned earlier in the presentation, along with certain members who are working with the Department of Mental Health for their adult community clinical services or have previously accessed adult community clinical services. There are two types of CPs. We have our behavioral health community partners and our long-term services and supports community partners. Both can provide each other services. So a long-term services and supports CP can provide behavioral health care and vice versa. However, which program a MassHealth member is enrolled in just depends on which of those needs take precedent. So if a member has stronger LTSS needs, they'll be enrolled in an LTSS CP. If they have stronger behavioral health needs, they'll be enrolled in a BHCP. Specifically for our LTSS CPs, we serve members aged 3 to 64. We do not serve enrollees who are a member of One Care and SCO and PACE and those additional programs that Emily and Susan had mentioned previously. Our LTSS CPs can specifically support up to 9,000 ACO MCO members, so it's a bit smaller of a patient population. However, we do help with care management and coordination for those members. providers who want to enroll their members into a community partners program should reach out specifically to the ACO or MCO that your member is a part of. You can also refer to their patient's ACCS site office if they are a member of DMH receiving adult community clinical services. Or if your patient is working with a provider that also happens to already be a community partner, you can just reach out to that office themselves and they can help with enrolling a member into the CP program. So the supports that we offer are very tailored to the patient themselves. We start off with a fairly comprehensive assessment and a health-related social needs screening, and this specifically tailors what is necessary for the member themselves. We can provide things such as connections to options counseling, medication review, connection to social services, connections to primary care and other health needs. For example, we will provide, community partners will help connect people to dentists. They'll connect people to specialty care if they have something like sleep apnea that's impacting their health in multiple ways. We can coordinate home-based care for those who are homebound. We visited a LTSS CP yesterday who actually helped connect one of their enrollees to home-based dental care because focusing on increasing dental appointments was something that they wanted to focus on for their patient population. For specifically our younger population, since these CPs work with children as young as 3, they do also help with IEPs and other educational needs, as well as what the needs of the family are in order to help provide comprehensive care. Because obviously for LTSS needs for minors, it's not just an individual, it is their entire family, and they support the entire family, whether it's medical devices, connecting to food and transportation vouchers, et cetera, and also making sure that they have all of their appointments lined up. They can arrange transportation to those appointments. And also just checking in and making sure that the enrollees are receiving the care that they need, transitioning in and out of nursing homes, inpatient stays, behavioral health stays, and providing a wellness and health and wellness care chain. Specifically for LTSS CPs, there are 8 organizations across Massachusetts that are specifically LTSS CPs that cover the entirety of the state, including the Cape and Islands. And that's pretty much it. They focus very much on providing and coordinating all of this care. So they are not necessarily providers, but they will help coordinate enrollees to the services that they need. And that works a lot with, for example, OLTSS they'll work with other community-based organizations who can help provide certain services, and they do coordinate with each other when it comes to providing behavioral health or long-term support services needs. That's pretty much all I had. In the appendix that I have, I will be sending out a list of CPs, what their partner organizations are, and what areas of the state they serve. So you can figure out if a member wants to be referred to as community partner or if there's a need to refer them. It depends on which service area they are in. So I provided that list as well.
Great. Thank you so much, Susan, Jess, and Emily, for that informative information. I'm going to stop the recording now.